All right, a warm welcome to you from Geneva, Switzerland. I'm Reda Sadki, and this is an exceptional session of the REACH Network, Peer Learning Buy-in for Health Leaders. Today we're going to talk about the climate health risks and barriers, and in particular focusing on this climate and health risks and barrier survey, this global survey that was launched just a few weeks ago on the 15th of January. This is a collaboration with Grand Challenges Canada, and Grand Challenges Canada is committed to learning from those who are on the front lines of health crises, and with support from the global technology company ARM and the government of Canada. They're partnering with us, with the Geneva Learning Foundation and with the Teach to Reach community to ensure that the insights and lived experiences of the local health community, that's you, guide our search for innovations that are tailored to the unique challenges of climate-driven health risks. This is part of Teach to Reach. Teach to Reach 11 was held on the 5th and 6th of December 2024. We're actually going to announce a new date for Teach to Reach 12. So if you had this on your calendar for March or April, it's probably going to be in May. We'll keep you posted, but that's one of the announcements we'll be announcing more formally. Now, the Reach for Leaders Network, that is Relate, Engage, Act, Connect, and Help, something that has emerged out of Teach to Reach since January 2021. Tens of thousands of health professionals have been engaging individually. And what we recognized over time was that many of you participating in Teach to Reach were displaying exceptional qualities as leaders. And hence we invited you to create this Reach network. We did this together. Now, I'm going to start with the big announcement for today's session as we launch the Climate and Health Survey on the 15th of January. And initially, we had set the closing date of the 4th of March. So an important update for everyone is that the survey is going to remain open until the 11th of March 2025. Now, we're not allowed, due to the rules of academic publishing, because this survey will be the subject of an academic publication. We're not allowed to show any preliminary results at this point, but I am going to share with you why we're keeping the survey open. We've received 3,702 responses, and that is an absolutely amazing number, and that is really to the credit of the Teach to Reach community. I'm going to explain how we know that. When we look at who is responding to the survey, we have more than 32% of survey respondents who work at the local community level. Almost 20% work at the district level, and then 16% work at the subnational, so at the regional level. So that is really very much like the Teach to Reach community. In fact, more than 2/3 of respondents are coming through the link that we shared at the Geneva Learning Foundation. And then I'm also going to tell you the countries that have the highest number of responses. So I'm going to start with, let me see if I can do a top 10 countdown. So number 10 is Ivory Coast. Let me see if we can do this with a little more decorum. So these are the top countries from which we have the greatest number of responses. So we'll start with Côte d'Ivoire, Ivory Coast. That's number 10. Number 9 is Uganda. Number 8 is Tanzania, the United Republic of Tanzania. Number 7 is Burkina Faso. Number 6 is Cameroon. Number 5, and the only Latin American country in the top 10, is Brazil. Number 4 is Kenya. Number 3 is the country of Ghana, the country of Kwame. Number 2 is the Democratic Republic of Congo. And the number 1 country with the highest number of responses so far to the Global Climate and Health Survey is Nigeria. So we want to go, even if you are the only person so far who has responded to this survey from your country, we want to congratulate you and thank you, appreciate you for the work that you have done so far. And let me see if there are messages right now. It looks like we've got mostly hellos. So we're going to share a few more of those before we get down to business. And then we're going to explain what that is. Hello back to Abubakar Umar, to Mohammed Umar Sakwa from Bauchi State, Pamela and Jeru from Kenya. Patience Monia, greetings from Lagos, Duka Ozor. Always a pleasure to recognize names, but this is such a massive community. We do recognize the exceptional leaders who consistently show up, consistently attend and commit and follow through on their commitments. Dr. Samarendra Biswas from India, Nezan Gadiadza from Harare, Zimbabwe, says climate change severely impacting society, resulting in ill health showed by malaria and instability. And then Rolad Musa. So let's stop here for the introductions because we do have something that we want to get to. What I'm going to ask you to do is to listen to this series of key messages and reflect on them, compare. You probably, if you're here today, that means you're exceptionally engaged and committed. You are a leader in the Teach to Reach community, in the Reach network. You've probably tried to talk to your colleagues about the Global Climate and Health Survey. Many of you have done a lot, have done so much to get colleagues on board, get your networks and fellow or organizational partners on board. And so we want to test this with you. And you saw this in an email recently from us. So why take the Global Climate and Health Survey? Listen to it, but don't put yourself in your own shoes. Put yourself in the shoes of a skeptical colleague, someone who, when you first approached them about the survey, they said, look, this is not going to help me. This is a waste of my time. This is not going to help me put food on the table. So why should I waste my time on something like this? So you think about that colleague, and we all have at least one who's really looking out for number one, who doesn't care from an altruistic perspective, may also be skeptical about the impacts of climate on health, or may not understand what that means simply. So tell me, listen and think, and then I'll ask you what you think of this series of messages. So today, we need 15 minutes of your time. Tomorrow, this information will help your work and your community. Here is how. Here's the problem. Health workers in your country see climate change harming people's health every day. For example, more flooding brings more cholera. Water shortages makes more people sick. Heat, extreme heat, harms pregnant women and children. But when we report these problems, others are going to say, it is just one story. And they're going to ask, where is the proof that this is actually the impacts of climate change on health? So here is part of the solution, one contribution to the solution. When many health workers from our country fill out this survey, our experiences become proof that leaders cannot ignore. Funders and governments can then use this proof to bring support. Your community is more likely to get the help it needs if there are many responses to this survey. So here I'm going to turn to our Reach leaders who are with us in the Geneva Learning Foundation's Zoom studio to ask, is this a valid argument? Have you tried explaining this to your colleagues? What have you said that has actually, we're particularly interested in the things you may have said that have actually got the skeptical colleague to say, okay, I see why this is not a complete waste of my time. So I'm going to actually complete the survey. And you were then able to verify that this actually happened. So if you'd like to answer this, please raise your hand. Let us know what arguments you have used, that especially the ones that have been effective. Those are the kinds of things we are interested in. Again, if this is the first time that you are able to attend, we're very interested in hearing from you. And we know that so many of you, especially those of you who are making the effort today to join this session. All right, I see many Otter AI note takers. Luckily, not as many as actual participants. All right, unfortunately, they cannot speak on your behalf. But so if you see your microphone activated, that means that we're asking you to speak. All right, Lilian Mutua, please go ahead. You'll be our first speaker. So you just heard the argument we believe may be useful to persuade, to explain to people why it's in their interest to take this survey. Can you introduce yourself and then tell us how it's been going so far? I know you're a very committed leader and you've been active around climate change and health since our first special event in July 2023. Lilian, how are you? Are you able to speak to us?
Thank you so much, Reda. Good afternoon, good morning, good evening from where you're listening to. My name is Lilian Promotion Unit in Nairobi City County, Kenya. I know that I've persuaded a lot of people to take this survey. Firstly, I'd like to recognize that within the health sector of the county government, there is a new chapter for climate change under the public health sector, and trying to persuade people to take this survey who are working within that sector and other colleagues within the health departments. I know there is a lot when we are negotiating for people to carry out this survey because they don't know where we are starting from. I've been sharing links. Some people have joined in, others have not because of different constraints. First, connectivity issues. Secondly, the data bundles for them to connect to network, which is a cost to their side. And also the conflicts of timing, listening into the sessions, but I'm still persuading them to carry out the survey. The other thing is that most of them feel like these surveys are being taken so that people can get grants from developing world, the developed world, so that the governments are able to use that money. And there's currently a lot of mistrust from the health workers, from the public to the government. So people are not trusting the government, but as a leader, I continue to endeavor to bring more people on board. And I'm also presentation where I can be talking into when I'm asked foundation. Thank you, Reda. Thank you for all the over to you, Reda.
Thank you so much, Lilian Mutua, for your leadership. And appreciate all those are yes, extremely important considerations, especially that question around trust. Hadiza Nuhu, you are ready to speak, I believe. Hadiza, we'd love to hear from you. Don't forget to introduce yourself. You heard what we think is a valid argument. We're looking for your feedback. If you're here in our studio, it probably means you've been really committed to making this survey work for people in your community. Tell us, how are you doing and how is the survey in where you work? All right, we lost. Let me just see if perhaps that was by mistake. Let me just go back. All right, and let's go to Laura Omari, Louise Karue, Margaret Rukindo, asking you to unmute, as well as Mary Mbukpa. If you want to raise your hand, of course, the correct procedure, let me show you how to request to speak. So first of all, type your message in the chat. I am trying to keep up with the messages. So this is something substantive you want to say in response to questions we're discussing. Raise your hand, check your microphone and headset, and then be ready to unmute your microphone. So we're really looking for your feedback on the survey so far. The big news, in case for those of you who are joining a little bit late, is that we are extending the survey by another week. So please, we're asking, let's go to Pamela, Patience, Ina, Elizabeth, Sandralyn Owusu, Solace, Jewel, asking you all to unmute to be able to share with us how. All right, Fanny, good to hear. Wonderful to hear from you. You also are a long-standing leader in the community of scholars of Teach to Reach of the Geneva Learning Foundation. You're also a TGLF alumni ambassador in Nigeria. Fanny, are you able to speak to us? And this will happen. Fanny seems to have a connectivity problem. So please, again, we've shown how you can request to speak. And we're looking for your feedback about how the survey is going. We are extending by another week. So really looking forward to hearing from you. You do need to, so the procedure is very simple. Type your, all right, Rebecca Bello is having challenges with the network. So we'll keep going. This is the main question, main update. All right, Mofijor, please look on screen to see what you need to do to be able to speak. All right, so Mofijor, please.
Thank you very much. I'm very happy to participate in this platform. And this is Mofizur Rahman Mamun. I am actually working in the Bangladesh Red Crescent Society in Bangladesh, which actually working for the forcibly displaced Myanmar national people, abdomen communities, with the community health worker. So I think that as a fellow of the Dhaka University, recently I completed the climate change and public health, one of the fellowship, and is actually the very important topic to more understanding the community, to support in future generations to prevent to the different kind of the diseases. So thank you very much. I'm happy to join with the general conversations. Thank you very much. Till today.
Okay, thank you very much indeed. And Mofijor, before you go, can you mute again? Yeah, so tell me, how have you been disseminating the survey? We do have some questions we've asked before, but I don't think we've ever asked you. First of all, is your organization a survey partner? Why or why not?
Yeah, regarding this issue, because I am have to discuss with my organizations first. then I have to the advocacy from my level. But now it is very difficult to the answer to why and why not.
Okay. And
But
then can you tell us who you have invited to take the survey and what concrete steps are you taking in your context in Bangladesh, in the Red Crescent Society to ensure effective dissemination with your colleagues, whether they're staff or volunteers? So that's a more feature. That's another question for you.
do you hear me?
Yes, now we hear you. Yes.
Actually, actually the we are try to the involve to the this kind of the survey from we have the community-based health working group. There are around 30 staffs and more than 200 volunteers engaged with the effective dissemination for these types of the survey. Over to you.
All right, wonderful. So let me see. I can see how many responses we have actually from Bangladesh. So that is, and right now, currently, we have 40 responses from Bangladesh. Unfortunately, that is 10 times too small to achieve any kind of statistical significance, even without looking at the breakdown between system levels and so on. So right now, as I said when presenting the key messages, there's a risk that we may not be able to ascertain what are the barriers to climate health action in Bangladesh unless we receive a lot more responses. That is one of the reasons why we are extending the survey. And again, to be perfectly clear, what's at stake is that with insufficient data from a country, some donors may say we would like to help, but if health workers have not been able to tell us what they are seeing, what is their perception of barriers to climate health action, then we're not in a position to help. So that is, of course, our way at the Geneva Learning Foundation to explain this. We are not a donor, and the donors may have different ways of explaining it, but that's certainly how we see it. Over to Nefi Iselmu, a warm greeting to you. And would love to hear from you. How is dissemination of the survey going? What's your response to the initial set of messages? And tell us if your organization has become a survey partner.
Hello?
Yes, El Hanafi, over to you.
Hello?
We can hear you loud and clear, but I'm not sure if you can hear us.
Wait.
All right, is a francophone who probably landed here by mistake. It does seem like there are a significant number of new people who haven't attended this before, so I am going to take this opportunity. So please do raise your hand if you want to share feedback on the questions that we've seen so far, or just share what is happening with you with the survey dissemination in your area. Just to recap, this is for the pilot group, but has now been extended to the Reach Network. We initially wrote you because of your exceptional contribution to Teach to Reach 11, and invited you to not just take the survey, but actually apply to become a partner. So I'm going to review the different steps, and then we're going to do the practical activity to close this session. We wanted to keep today's session short. So first of all, if you have not seen this already, I'm sharing the link to the article in the Lancet journal. This is the announcement in a way for the survey at the global level. So of course the Lancet is a medical journal that is widely respected and really one of the key sites to explain. I'm just showing the actual article here. Identifying grand challenges through participatory research is the topic. And you can go, of course, the article itself is open access if you want to learn more from a scientific perspective about this. So next, we invite you to read the press release this is from Grand Challenges Canada, but of course co-signed by the Geneva Learning Foundation. I'm going to show you again the press release and invite you to go look at that. And in fact, this will be the practical activity. You can see right now.
Sorry, I didn't get that.
Is that Mary? All right, Mary. Okay. And then we have Kingsley. We'll come to you, Kingsley, right after I finish explaining what the steps are. So you can see there's 55 likes, 29 comments, and 17 reposts. So compared to the size of the Teach to Reach network, actually very few of you. And now that we have more than 100 organizations that are survey partners, this is a little bit underwhelming, especially, and is likely to result in some countries not generating statistically significant data to be able to accommodate this. I'm going to show you, if you look through your emails, you will see that you have received the invitation to become a survey partner. Let me just do this here. And Kingsley, we're just going to ask you to mute your microphone because I think we are getting feedback just for a second and then we'll come to you. So in order to become a partner for the Climate and Health Survey, some of you have missed one of the steps. And the critical step is once you have completed this questionnaire, you will receive a confirmation but it's an application. To validate the partnership, we ask you to disseminate the survey and then document that you disseminated. If you do not do that last step of documenting, then unfortunately we will not be able to recognize you as a formal survey partner. So then the partner selection criteria is that you have your organization. So this is for organizations, not for individuals. You need a complete application. You need to be an authorized representative of your organization. We've seen some people who do not have the authority and they commit their organization. We cannot know. So we ask you that question. Are you an authorized representative? If you are not, you then cannot commit your organization to becoming a partner. Now, by the deadline, we've extended the deadline just as we're extending the survey. And of course, there's a critical step of review and approval by the Geneva Learning Foundation. And then that final step is actually the proof of dissemination. So we've shared the mechanism by which you can fill out what we call the dissemination register to actually document how you have shared this. So now we're actually going to do the practical exercise before we close. Let me just see. Let's go to Kingsley. Kingsley, we'd love to hear from you. And you also are a long-standing leader in the Teach to Reach, Scholar, Immunization Agenda 2030, and Climate and Health communities. How are you doing? What's your update today? What's on your mind?
Thank you very much. I'm so grateful for once again to share my view. I work for Community Youth Development Foundation, a non-governmental organization based in Ghana, Kintampo in the Bono East region. Kintampo is also noted to be a center of Ghana. I am encouraged to share the climate change and health survey because looking at how climate change, we are experiencing certain things in Ghana and in Kintampo, did not hesitate to share the survey links to like-minded organizations, planners, agricultures, and all that you can talk about because climate change is affecting us a lot. Why? Because 15 farmers who went in for loan for cultivation of crops, rainfall, suicide. I can count about 15 of them who committed suicide because of climate change, the crops that they cultivated for. And the loan that they went for, going in to pay for that particular loan, they can't get that money anywhere. So the alternative is that they should commit suicide. So climate change is adaptation strategy. And I can say climate adaptation is no more a curse. Adaptation and then to mitigate climate change effects so that we can save lives in this particular country. Reader, I can say climate change today, people are suffering. They could be found in the room. The room is, and I'm just imagining who has condition in the room, how she's going to adjust or adapt to this particular climate change situation. So our voice indeed matters to the climate change first, and then adaptation plans that we can develop to help solve all these particular problems. Thank you very much, Vida, and I'm over.
Thank you very much indeed, Kingsley. Let me see. There do seem to be, okay. Yeah, I don't see any other hands raised right now. I know that if you're here, if you've taken the care to attend this meeting, then obviously you have an interest and a commitment to this survey. So please, the purpose of these sessions is to get feedback from you on how a survey dissemination is going. We're now going to finish this session of the REACH network of leaders, of health leaders, with the practical activities. So I've just pasted in and you can see it here, the links that you have seen before. And these are links that I know many of you have already shared. What I'm going to ask you to do is when you share to add a personal message to actually say, deadline extended, so people have another chance, and really think about if you can add that personal touch, because I'll show you how it works. So if I click on share on WhatsApp, this automatically generates a link with the link to the survey, a message, that will go to your WhatsApp status or that you can send to a group that you're a part of. Your voice matters. Take the Global Climate and Health Survey today. Now, this is the default message. If you've already sent this message, I would encourage you not to send it again. Yes, I would encourage you to personalize it or adapt it. So that is for WhatsApp, which I know is probably the key means of communication. But as there's also X, so let's go see if Yes, I can. Yeah. So with X, so this used to be called Twitter, you can create an account if you don't have one, connect with colleagues, follow the news, follow. It's great for live, real time things. It's also a controversial network, but that's a different topic. And so you can automatically post a message here, as you can see. And I'm actually going to repost. I haven't posted in a while. And there you go. That's all I need to do. So again, we're going to see if we have any notifications. So if anybody has actually posted here, we'll see it here because we'll get a notification. Right now, no one has posted on X. So please, if you have an account on X or Twitter, use the link that is in the chat in order to go there. And actually, you don't have to do anything. The message is pre-made. If you can add a personal touch, that is, of course, preferable. Let's go to Laura Omari, who has her hands raised. And again, you can find the links in the chat. Laura, we'd love to hear from you. Laura, you need to respond to the request to unmute your microphone. The problem is if you miss that message, then if you say no initially, because many people, when they see something pop up like that, they ignore it. I don't know. Then you have to reactivate somehow. That may have happened to you. Let's keep going. So now we'll go to sharing on Facebook. Oh, no, sorry. Sharing on LinkedIn. That is probably the most important network for us. And here you have, all right, you can see here. Now, if you have already commented, reposted here, what I would suggest is that you add a comment here. And if you look on the Geneva Learning Foundation's webpage, you will see many messages about the global health climate and survey, so you can share those with your colleagues. Some are more recent than the ones we're sharing with these links. The same thing with Facebook. So if you use the Facebook link, again, the good practice is to comment. First, you can use or love, in my case. You can share, so you can send that to your feed, and always put a personal message at the top here, and then share. And that's all you need to do. And this actually is the main way that this survey is being disseminated, because it is all digital. So that is really the key. Let me just see if... All right, Laura Omari, it looks like your microphone is now unmuted. Have you actually requested to speak, or is that a mistake on your part?
It was a mistake, but I can still speak.
Okay, please. We'd love to hear from you. Don't forget to introduce yourself, even if you already have done that in the past. Tell us who you are and what you do. And then tell us what is your experience of the survey? How are your colleagues and networks and partner organizations responding to it?
Okay, my name is Laura Omari. I'm a public health officer, a professional, still young in the industry. I love this climate change topic. I believe it should be discussed. I come from Kenya. Climate change is important to us. The rise in temperature, the extreme rainfall and stuff. How this change affects health. I think in Kenya, it brings about vector-borne diseases like malaria, food insecurity, malnutrition, respiratory diseases in Turkana coming on. Nowadays, climate disasters have made a drought to be something big. We are talking about also waterborne diseases like cholera, typhoid, contaminated water that are very big public health issues, including respiratory diseases down here at the grassroots. Us as health workers, being the front line, I think our role as health professionals, we need to educate everybody from the youngsters from the school levels. We shouldn't oversee how influential young people can be to these programs. We should provide education on climate change. We reach out to these people struggling from disasters of climate change. We should also support solar powered in health facilities, things like waste management, all these things. I think we should work on government policies, the health sector. And community level, we should plant trees and stuff to assist. We do believe that we have a big network of public health people in Kenya who we can reach in many industries. I believe we are not in organizations right now, we are still out, but we still believe we can still create impacts through reaching out to the rest of our public health teams that we had in our, I think, universities and stuff, because I was also a youth leader in our universities. Anyway, I'll thank you all for creating this climate change forum where we can all speak, share resources, and talk about climate change. I believe it's an important topic. Thank you.
Thank you very much indeed. Laura, before you go, can you tell us how many people from your organization or in your networks you believe have taken the survey through your efforts?
It's my first time joining. I wasn't
Oh,
here for
really?
a while,
Okay.
but
All right. And have you been able to
yeah,
share through the links, for example, on WhatsApp?
I will do that today. I
Okay.
will mobilize today.
All right. All right. Wonderful. And so I'm not sure if we need another session 2 weeks from now. I think we may have one scheduled, but if we do have a session 2 weeks from now, when we actually are likely to finally close the survey, we'd love to just welcome you back so you can tell us what your experience has been. Again, we've tried to explain why this survey matters. There is no financial short-term interest, but there is a critical, what's at stake is critical for the future of communities. If donors and governments can always plead ignorance if they don't have the data that actually proves that climate change is hurting the health of the community that you serve. So that's why we believe it should be worth it to take 15 minutes of your time to respond to the survey. Thank you very much indeed. Now it's taken a little while, but we've now got many hands raised. So let me go to Umar Pella Abdul Rahman, and then we'll hear from Emmanuel Jacob. Umar, over to you. We'd love to hear from you. Tell us who you are, what you do, how you work for health, and then what has been your experience of this survey, this global climate change and health survey so far.
Yeah, good afternoon, Mr. Dr. Rida. Good afternoon, everybody.
We hear you loud and clear, Umar.
Yeah, actually, I have been a participant in this climate change. Right now, I'm working with the non-governmental organizations, having put some years working with the WHO and the public health specialists. Climate change as it is actually has an impact on health, just as here. Where I am presently in Nigeria, we have three basic issues related to climate change. Number one, we have heat stroke, because right now, during hot season, the temperature here now is around 40 to 42 degrees centigrade. So it affects our elders can't withstand this temperature. It usually have a harsh weather on them. Now, during rainy season, we used to experience disasters which may associate with any waterborne diseases. So it's also related to the climate change. And the second climate that we experience is the dry season. Also, we have drought. During rainy season, there is a season that we experience drought. And at that time, if the weather is not conducive, the rainy season is not forthcoming, we experience food scarcity, and which may translate to malnutrition. I have did the survey, and I have shared survey to my colleagues, about 12 of them that I have talked with, and unfortunately, I did not get a reply as to how far they have gone. But I think this week I'll try to get in touch with them to know exactly whether they were able to take the survey or not. So basically, this is I have to say on the global climate and health survey. Thank you very much.
Thank you very much indeed, Umar Abdul Rahman. As I said in the opening of this session, for those who joined late, there are only 2 countries that have a sufficient level of responses to achieve some kind of limited, at least partial statistical significance. So unfortunately, many countries still have an insufficient number of responses. We'll be sending out another message about that. We realize it is difficult and challenging. We realize the survey is digital only, and many of the people best placed to respond probably may not have either the literacy and or the digital access in order to be able to respond. So that's one of many limitations, but we still feel that what's at stake is sufficiently important to warrant really continued effort. So thank you, Umar. Over to Emmanuel Jacob. I thought we would be able to do a short session today, but I'm actually glad to hear your voices and your feedback on the survey. Emmanuel Jacob, asking you to unmute and looking forward to hearing from you. Don't forget to introduce yourself and tell us who you are and how you work for health. And then second, what is your experience of this global climate change and health survey?
My name is Emmanuel. I'm an environmental health worker. So basically, based on the survey that...
I'm sorry, Emmanuel, I'm having trouble hearing you. Is there a way you can speak closer to your microphone, please, so that we're actually able to hear you?
Okay. Can you hear me now?
Much better.
Okay. I said I'm Emmanuel Jacob. I work in primary health care as an environmental health officer. And basically, the challenge is based on how I took the survey. I noticed about shortage of water and agriculture, which the excess heat has caused a lot harm to food and also to pregnant women, and children. Also, children who find themselves in, and some of these schools, they don't have fan, AC, and even at home, it's not everybody that has access to lights, particularly in this my area. It's not everybody, the light is not stable, and you'll find out that in the night, someone will hardly sleep, and due to excess heat, it can lead to meningitis, which will cause someone to go to the hospital and will not even know what is wrong with him until that person go to the hospital. You understand that? And again, looking at the health of people who find themselves in the kind of area, in the area which there is no light. But I think by making provision of which will be given to some people who don't have enough resources, like in providing lights, you understand, like solar, some of them can be able to put it in their homes in the night, maybe while they are sleeping, while in the afternoon, they might charge it, then in the night, they will make use of it. And I've shared the link to some of my friends, and I'm waiting for them to give me a reply. Thank you.
All right, wonderful. Thank you very much indeed for this update, Emmanuel. Want to acknowledge also the message from Margaret Rukindo. I think she has a connectivity issue, so we won't be able to hear from her, but she says, I have shared this survey with colleagues here. This opens up more insights in my community, and I'm optimistic that the findings will save a lot in regard to mitigation measures for dissenters or dissertators of climate change. Let's continue with the discussion and narratives in the topic, as personally I have benefited in my way of work and many approaches from experience sharing from my global colleagues, from colleagues all over the world. Douglas Saka also says, I have shared to all my platforms and groups, especially on WhatsApp, any responses from Zambia. I am actually in a position to tell you today how many have responded from Zambia. So right now we have 27 responses from Zambia, Douglas, and that is, we would need at least 400 for the data from Zambia to have some kind of at least partial statistical significance. That does not mean it is useless. If it is less than 400, we can look then at the region that Zambia is a part of. But nevertheless, it would be difficult to draw any conclusions about the perceptions from health workers and humanitarians in Zambia with this small number of responses. Again, what's at stake is global donor decision making. They will be looking at the data from different countries. Just want to acknowledge also a question from Ismaila Ibrahim Edego. I don't know if he's still here. Let me just check. Yes. And Ismaila wanted to know, what's the fate of an independent consultant to an organization with respect to becoming a partner of the Global Climate and Health Survey? Typically, consultants are not authorized to represent an organization. But nevertheless, you may be able to talk to the leadership, the management, the decision makers. And if you are at that able to engage them, then of course the organization will designate a representative, and they could certainly designate a consultant. Ismaila Ibrahim Edego, you also had a hand raised. So we do need to close this session as we have the Francophone sessions on a different Zoom link coming up soon. Ismaila, if you could briefly introduce yourself and tell us what's on your mind, if I haven't already answered your question.
Yeah, thank you very much. Good afternoon, everyone. Am I audible enough? Over?
Yes, loud and clear.
Yes, my name is Ismaila Ibrahim Edego, immunization consultant from Nigeria. Actually, one of the questions which you have answered, but I just wanted to add to what the two previous colleagues said. I want to add that the climate change has actually brought a lot of insects that are affecting crops in the farm, and that even after our crops need chemicals along the line, some of these chemicals affect the consumers after they purchase or use this commodity, which is one of the things that we today. So apart from the flooding, the climate changes, the diseases that come with it, this is another challenge that we are also facing, which has to do with the insects and pests affecting crops in the farms. And then during preservation, the chemicals that are used also affect consumers during. Thank you, and over.
Thank you very much indeed. All right, we'll have one last person. It took a while for everybody to get going, which is perfectly understandable. Ayman Igwebe, please, over to you. Do introduce yourself. Tell us who you are and how you work for health, and then your experience of this global climate change and health survey. Ayman Igwebe, so you have to now respond to the request to unmute your microphone, or else we will not be able to hear you. Also, Rebecca Bellows' comment on screen, who says, I know she has a connectivity issue, is that the climate change is really affecting people in my community, especially children. The increase in temperature is causing a lot of sickness in children, ranging from malaria, indigestion, and sometimes difficulty breathing. All right, it looks like we won't be able to hear from Ayman, so we're going to close this session and look forward to reconnecting very soon. We are changing the dates for Teach to Reach 12, so look for the announcement. We had initially said March, then April, so we're going to move it again, I think, and we look forward to staying connected with you, continuing to meet, network, and learn. I want to acknowledge Gifty, who is another long-standing leader, to say warm welcome to you. It looks like you joined too late to come in now. And greetings to all of you. We're going to do maybe we have time to do what we call the rewind, where we look at some of the comments that came in. Many of them, in some cases, we're not able to actually show. So let's go to that and see if we can manage to do that, to do a little bit of that. Once again, thank you and see you soon. Keep doing what you've been doing. 2/3 of the responses to the survey have come through the Teach to Reach Leaders Network. So that is why you are hearing applause now.
Thank you very much. Thank you, everyone.
The deadline is the 11th of March, so there is another week. We may extend again.